Welcome to How to Create a Health Advocacy Business, presented by the Bridge Health Advocates, owners and founders Melissa Cardine and Jennifer Whalen. We both hope you really enjoy this presentation today. I wanted to take some time to introduce myself a little further. This is Melissa Cardine, RN, MSN, BCPA. Since today's topic is talking about how to create a health advocacy business, I did want to back up to 5 years ago in the fall of 2015 when I started the Bridge RN Patient Advocates. The Bridge RN Patient Advocates is where we serve clients, providing them advocacy services. 5 years ago, I really did not dream I would be where I am today in the field of advocacy. So talking about how to create a health advocacy business, my number one piece of advice that I mention over and over to people is when you first need to make the decision that you are going to do this, and that is a very hard decision. But in your mind, you really have to make the decision that I am going to become a health advocate. And once you make that decision, you need to start telling everybody you know what you're going to be doing. That is honestly how I started as a patient advocate. It was sort of just a light bulb moment that this is what I was meant to do and this is what I wanted to do. And I just got that mindset and I went home and told everybody I know, my family, my friends, my colleagues, that I was going to start a business as a patient advocate. And honestly, that's what I did. So one of the first steps when you're thinking about how to create a health advocacy business might be 1, the mindset, and 2, just start saying it aloud. Say it to others. And how does it feel? Let's talk a little bit more about why you would want to actually start a business. Instead of, say, working for a hospital, an insurance company, or a professional organization. Well, the first thing that comes to my mind is flexibility. Usually, when you work for another entity, you will be responsible to, say, clock in and clock out at certain times, or you'll need to be available between these certain times to do your job as a patient advocate. For example, in the hospital, maybe you have to work Monday through Friday from 9 to 5, or an insurance company, same thing. Maybe you have to work from 8 in the morning till 6 at night and be available during those hours as an advocate. The other thing I think of why start a business is you do get to be your own boss. That means that you really are running your own company. So you can run your company the way you want to run your company. For example, in this type of business, as a health advocate, is the only one you're truly working for is your client. You are not working for a hospital system, a physician, or an organization. You are working for your client. Also, what comes to mind is when you own your own business, as I mentioned before, is that when you're your own boss and making decisions, you get to make those decisions, which honestly can truly make a difference. For example, maybe you want to offer some pro bono to a client. Well, as the owner of that business, you can make that decision. Sometimes we feel confined when we work for somebody else, that we want to do a little bit more, but we can't because we are working for somebody else. But when you own your own business, you can truly make a difference and create that business, which really leads to innovation. Is creating a health advocacy business, how do you do that? Is you need to be innovative. There is no just set format of, this is what a health advocate does and this is what you're going to do. That's the exciting part of why to start a health advocacy business is the innovation and what you can create and what do you love doing as a health advocate and what services are you going to offer? Along with freedom. Again, we've touched about that. And in the long run, it's really rewarding to start your own business. As far as financial reasons, they're going to look a little different. What is going to motivate you to start a business is hopefully you are building something of value. You're actually building a business, getting clients, and bringing value to that company. There are several tax reasons maybe you would start a business that you can discuss with your CPA. But financial reasons are also another reason why people start businesses. Let's talk about the entrepreneur life. So the first thing that comes to my mind is no longer are you going to work, say, on Monday morning and getting there at 9 a.m. and clocking in. On Monday morning, you're going to have to be waking up and working on your business. And then you're going to have to work on your business all day long or for the allotted amount of time that you plan to work on your business. So this is a lot different than reporting to work. And whether you work a part-time job or a full-time job, usually you have a set schedule to work and say clock in at a certain time and clock out, that you have to be available during those hours for a job. So when you're an entrepreneur you will need to do the same things, but you are going to be the one motivating yourself to get up in the morning and to work on your business and scheduling when you are going to actually work on your business. And this is a little bit about being a self-starter. You're going to have to be the one, your internal motivation is going to be your driver to be an entrepreneur, which leads into the business mindset. So again, when we're talking about starting a health advocacy business, we are in the service industry where we provide a service and then in turn we receive money for that service. And if you're anything like me, sometimes it's really hard to ask for money for a service that we provide, especially if we don't know the worth or the value of that service. So somebody may do something for me, right? And they'll say, how much do I owe you? Or I do something for somebody and they say, well, how much do I owe you for that? And I'm like, unless I have a receipt that says the concrete amount that cost me to buy something for them, but if it's a service, I struggle with saying, well, I think you owe me $60 for that, that service that I provided to them. But the business mindset is you are now going to be providing someone your services, and in return, they will pay you for that services. So you really need to know what is your worth and your value. And I just want to take a little bit of time to talk about your worth and your value. So some people might be like, well, that's a lot. You make a lot of money like per hour. So let's talk about that per hour. So all that time that you are providing somebody and they're paying you per hour, you need to reflect back on what is your education and how much time and money have you spent on your education which brings value to the service you are providing. Along with your education comes your experience. How much experience do you have in the field? And with that experience, again, it might be hard to come up with a value, but if you have any personal experience, work experience, that will increase the value of your time that you're providing them a service. And your expertise. Maybe you've really studied an area. Maybe you're very affluent in insurance or cancer research, but if you have an expertise, that also will increase your worth and your value. And how do you get clients? So now you're an entrepreneur, but how do you get people to actually pay you for this? Is really through networking. It's, as I mentioned previously in a slide, is telling everybody you know what you're now going to be doing and what you do as a health advocate. That is networking. It's creating relationships with others that will provide you referrals, and you will utilize them as a resource. And any entrepreneur will tell you that networking is key to running a business. It's customer service. It's building relationships. With that is innovation. So part of being an entrepreneur is being innovative, being flexible, and especially with change. So some people struggle with starting a business and getting it perfect before they even start. Unfortunately, you're never going to have it perfect right away. So you have to have that mentality of, I am ready to start. I have the guides. I have a plan. I am going to do this. And when something sort of comes at you, maybe it's an opportunity that you never even dreamed of. Well, that's an opportunity, but you have to be flexible. Maybe it wasn't part of your plan, but you have the opportunity, and maybe you should take that opportunity. Or maybe it's going to be a struggle that you didn't realize that you had this plan and it's not going to work out the exact way you thought it was going to work. So part of being an entrepreneur is being flexible and innovative, especially with change. And that brings up challenges. So being part of an entrepreneur, and if it's your own business, you have to own those challenges. And sometimes when you worked for somebody else, you can be like, well, that's my boss has to deal with that. My manager has to deal with that. The director has to deal with that. The CEO has to deal with that. Well, now it's your business. You're all of those people. You are the manager. You are the director. You are the CEO of your company. So you do have to deal with those challenges. Hopefully, through building a tribe of like-minded individuals, that you will have advisors, you will have people when challenges come up in your business, you will have people to reach out to and say, you know what, I'm struggling with this happened, any ideas, how we can improve this, any resources, again, through your networking, you can reach out to your network and ask them, do you know anybody who can help me with this? Didn't foresee this coming. This is happening. So there's a lot of books, resources that really talk about being an entrepreneur, and it's exciting. But remember, it's just like a career. If you've never owned a business and you've never been an entrepreneur, it is going to take you years and years to master being an entrepreneur. This is just the beginning of your journey. And how exciting is that? So now you're telling everybody you know that you are going to be a health advocate, that you're going to own your own business and be an entrepreneur. So you're taking that step, that leap to owning your own business. But why health advocacy? Why not? Right now is the best time to start a health advocacy business. Number one, our U.S. healthcare system is complicated. It's always been complicated. It's still complicated. And I don't see anywhere in the near future that it's not going to get even more complicated. So right there is one of our problems that as a health advocate, we are going to address for our consumers, is we're going to help them through this complicated healthcare system. Baby boomers, their expectations are very high. They want the best. And with that, as we know, if you don't have a health advocate by your side, somebody who really understands the healthcare system, you may not always get the best care, the highest quality care. So we know right now that it's the baby boomers who are the largest population who need our services, and we can help. Along with, right now, we're in a sandwich generation. We have people who are aging and need care, and the middle-aged person who also has children at home. And sometimes they don't know what to do because they have to go to work still. They still have kids at home, but their parents need help. And they can't do it all. And who better to help them than a health advocate? And they will pay for those services. So there's a need, there's a want. People need our help. Also, starting a health advocacy business starts with your personal conviction that you can help people no matter what, especially if you have the expertise. And when we're going through something in the healthcare system, personally, our emotions are involved. And when you're a health advocate, you could sort of be on the outside to help people as they are emotional, going through our system, helping their loved ones. You can sort of pause and look at that big picture to truly help people. That's that personal conviction, is I really want to make a difference. And that's why you do a health advocacy business. And some of these topics that we're talking about like why health advocacy business, I just want you to understand, because this will be a question you receive. Well, why are you starting a health advocacy business? So besides that personal conviction and the U.S. healthcare system and how fragmented it is and difficult to navigate, sort of comes some other questions to my mind is, well, would you show up to court without an attorney? I personally wouldn't. I do not know the legal system. I have an attorney for our business. Even when it comes down to signing any kind of contract or agreement, I seek somebody who is knowledgeable in that contract. It's the same thing I think of, would you file a really complicated tax return without an accountant? Probably not. Most people who have complicated tax returns would hire a CPA and pay them for their services, which included their education, their experience, and their expertise. So what is different about somebody paying you as a health advocate? And along with, if you do have any financial savings, you might even use a financial advisor to actually look through your portfolio and maybe suggest looking at your portfolio well, in order to retire at this age, you need to save this amount of money over the next 20 years. So it's the same thing as the role of a health advocate, is we're an expert in managing their health. And to have somebody look at their whole portfolio of health and say, well, gosh, we know if you stay on this trajectory of where you're at now, you might end up with, elevated blood pressure or diabetes or complications from your disease processes now. But maybe we can work with some providers and lifestyle changes to help that. So when I also think about why a health advocacy business, people are going to ask you, some of these analogies will help you understand, but also have a conversation with somebody else well, why is this needed? Why do I need a health advocate? And maybe this will resonate with you, and then when somebody asks you, you'll be able to respond on why you're a health advocate. What do health advocates do? The number one thing health advocates do is collect information. They listen and collect information. From that first initial phone call, when somebody reaches out, most likely they're struggling with something that's going on with them or a loved one. They're calling you and you're listening. And as you're listening, you're collecting information. And hopefully in your mind, you're thinking about, wow, this is somebody I can really help. Maybe it's somebody you can't help, but you're going to offer them resources if you can't help them. But we are constantly collecting and reviewing information regarding our clients' care. Whether it's that initial call, it's a formal meeting that we set up in person, via Zoom, or over the phone. We need to collect enough information so we can truly understand what our client and their families are going through. And with that information, we need to review it and see if there's any gaps or any areas that just don't make sense, and possibly do some research. Whether it's formal research, and we're going to be looking up actual research articles that are peer-reviewed articles of research that's been done maybe on a disease process, or research looking for different providers who may be able to help them, or hospital systems, or even some resources they just need in the community. But usually a health advocate is doing some form of research, helping them find resources and education. Another top area of what we do is communication, which is vital. We're not only communicating with our client and their family, but we're also communicating with the entire healthcare team. Anybody who helps and supports them, we are usually communicating with. We also can coordinate with transitions of care, say from a hospital to a rehab center, then back to home or to assisted living. We create medication lists. We review the medications and create medication lists. We provide information and resources to coordinate their benefits and insurance. Even if we are not an expert in those areas of insurance, we can find them resources that people who are more knowledgeable in those areas that can help them if there are any concerns with insurance, if they're struggling with insurance, any bills, we can coordinate those resources. Maybe there's some applications they need to have done for benefits or for advanced care planning. We can help them with those services. We can also create medical timelines. We can review their information and we can create a timeline so for the providers that they know, okay, here's a timeline of their surgeries. Here's a timeline of their, medical illnesses. Here's a complete timeline of everything that has happened, from the beginning of their birth or, in the last 20 years. Another area is attending medical appointments and communicating with providers and family members. So as we know, it is very important to have somebody with you at all medical appointments. Ideally, it would be you as a health advocate. And the reason being is there is nothing better than to be present during that physician appointment. One, so you can hear it firsthand. And then also, if there's any questions that need to be asked before you leave that appointment. And even if a loved one goes with, remember, usually the loved one also has an emotional attachment in this relationship. And they may not be the best one to take the notes and to listen and to confirm that everybody is on the same page prior to leaving that appointment. So as you can see with this slide, there's a lot that health advocates do. There's a lot of tasks. And when you develop a health advocate business, you will define what services you will be offering to clients. This just gives you an idea to start with of tasks that we do as health advocates. So we just talked about all the tasks that health advocates do, but honestly, what we really do is we help people find their voice. And we provide peace of mind, not only to our clients, but to their loved ones and the medical professionals who are involved in their care, because they know they have a health advocate on their side, somebody who has taken a vested interest in helping somebody and helping them have a voice. It's not our voice. When we work as a health advocate, we are representing our client and helping them share what their struggles are and helping them find solutions. Honestly, we're practicing healthcare the way it should be. The more you practice health advocacy, you will be saying this. You will hear me say this probably throughout the courses. But health advocates do not diagnose, prescribe, treat. They do not do anything hands-on for a client. They don't provide hands-on care. We do not make any decisions for our client. We provide them education and resources for them to make the best decision for themselves or for their loved one. We also don't take any money for referrals or placement. Therefore, our vested interest is only in the client. We do not take money from any other referral source say to refer to a certain provider. We do not, as health advocates, take that referral. So over and over, not only when people ask you, what do you do as a health advocate, you also have to be very clear to your clients and your families what you do not do. And this would be part of a client agreement, probably be stated on your website, stated on some of your marketing material, that you do not do the following. I truly believe when you are starting a business, especially a health advocacy business, we all have a personal story, because that is the driver of why we're doing this. You will hear me in other presentations talk about your why. And you need to know your why you're going to be doing this. And honestly, when I ask this question over and over again to people I work with and mentor with, the number one thing that comes up is a personal story. Whether it's your personal story, something that has affected you, that you now want to be a health advocate, or it's a personal story of a loved one, something you went through with somebody else that is now motivating you and driving you to start a health advocacy business. So as we talk about how to create a health advocacy business, we are going to talk about how to create a health advocacy business and provide you all the tools you need to learn how to be an advocate and how to start a business as an advocate. But what I don't want you to forget is your personal story, the story of your loved one. That is where it starts. So after this presentation, I want you to take a little bit of time and think about, what is your personal story? Write it out. It doesn't have to be perfect. But what is going to make you get up every day to run a business? Because remember, you're not clocking in. You don't have a boss. You need that internal drive. And usually that's your story. So after this presentation, take the time. What is your story? What's your loved one's story? So what does it feel like? What does it feel like to wake up every day as a health advocate, as your own boss? You feel alive. You know that you have complete control of your entire day. Even if you face challenges or your clients are facing challenges, you at least know you're helping them. Even when we might get frustrated that things aren't going the way you want them to be going for your client, at least they have you as a health advocate. So waking up in the morning and knowing, wow, I have these 5 clients who I am going to be working with today, calling them, meeting them, working on their behalf. Maybe you're going to be reaching out to a provider because you need to get some information to them regarding your client. And then when things start working, where it's like you call somebody and a light bulb goes off and goes, wow, like my client really needed this resource and I found a resource for them that I know is actually going to change their life, that feels good. Again, there's always going to be stress. We're going to have stress of running a business, but it's your business. The number one thing I wake up every day is make sure my clients are taken care of. Anything that is on my list to do for them is taken care of first. And then the business. Then you work on the business. And how awesome is it to go and network with like-minded people who also want to help people? Because that's who you're going to be networking with. You're going to be building your network of providers who are also in that same industry. They want to make a difference in somebody's lives. So you'll be managing your clients, you'll be networking through the day, working on your business, and hopefully at the end of the day, that all feels good. You feel like you actually made a difference. You contributed to society. You collaborated with others. You helped somebody today. So previously, we talked about what a health advocate does and what it feels like, but we really do have to talk about what does it actually take to start a business. And that's where the Bridge Health Advocates can work together with you on the following areas. The number one thing is a business plan. You have to have a business plan. It is an outline of how you're going to run your business. It keeps you accountable to what your plan is. It gives you structure. So we can help you with the business plan, with an actual format, with an actual example, and then you creating your business plan. And that business plan is mainly for you. Now, if you are going to be seeking, say, a partner or a loan, some kind of funding, you have to have a business plan. They will not give you a loan without a business plan. I don't think a partner would join you if you don't have a business plan. So it really starts with a business plan. And remember, you can start it and you can change it. As you learn more and you research more of the business, you can add to your business plan. Remember, we talked about an opportunity that come up. Maybe an opportunity comes up and you look back at your business plan and say, well, is this part of my business plan? Well, you didn't foresee it, but it does align with your plan, so you're going to go along with that opportunity. So that's where it all starts, is that business plan. And there are resources out there for you to create a business plan. The next area to think about really is the legal structure and insurance. You cannot start a business unless you are set up legally to do a business and insurance. And I'm not going to spend a lot of time on this because honestly, we need to dive a little bit deeper about what structure and then look at your background of what type of insurance. But these are check boxes. You have to set it up legally and you have to get insurance. And then you have to start thinking about, what is your why? Why am I doing this? What is your mission, your vision, and your values? And I will tell you that it takes a while to come up with a mission and vision, and you really should work with somebody to help you create that mission and that vision. Because you not only want it to make sense to you, you want it to make sense to others as they're researching your business and they look at, well, what is their mission and their vision? I tend to think that values, that's where honestly I started, was more, what do I value? What am I going to value as the Bridge RN patient advocates? And then what is my mission and my vision? Again, at the Bridge Health Advocates, we can help you really define your mission and your vision and your values. With that comes, what are you going to call your business? And how are you going to develop a brand around that business name? Branding, McDonald's, Nike, right away something comes to your mind, right? We all know the McDonald's symbol. We know the Nike symbol. So that business name and branding is, again, working with people who can help you develop your name and your branding and your identity of who you are as a health advocate. We talked a little bit about networking, and networking is, remember, creating that connection with people, but then there's marketing, right? So let's talk about McDonald's and Nike, I guess, because that's what I use for the branding. But again, there's marketing around McDonald's and Nike. So when you see that symbol, you already know what to expect. You also know what to expect, that what type of service you're going to get, what type of product you're going to get. So that's marketing. And you will have to market your services to others. People aren't just going to knock on your door. You need to get out there and put your name and your branding and your identity out there to attract customers. And that one way will be through a website. And with that website, not only do you need to find somebody to help you build the website, you need content for the website. And that is one thing we really work with health advocates, is helping them create the content. And we do that as a process from the beginning of your personal story. That's where it's going to start. Your why, your personal story of why you're doing this. And then it's going to continue on. Why you named your business the name you did. And more about branding and who you are and your mission and your vision. This will all go on your website, which is a form of marketing, which will help you network. They all go together. Along with, you will need some kind of home office and technology to run your business. And we will go into details of everything you need to actually run a health advocacy business, along with workflow. So I learned workflows when I ran an outpatient treatment center, and we had various lines. So we did infusion and bariatric and wound. And we had workflows from the time somebody called who was interested in our services that we offered at that clinic, all the way through making an appointment, coming in for your appointment, charting, follow-up, surgery, all the way through that whole workflow of that process. And here at the Bridge Health Advocates, we created a workflow from that first time somebody calls you, working with the client and the family, utilizing the forms through the whole process. That is sometimes where people struggle is, okay, I know I want to do this and I've got a business, but how? Well, that's a workflow. We will teach and guide you actually how to do this work. So as you can see, there are really important components that we are going to work on to get you to start a health advocacy business. And how exciting! How exciting! Health advocacy. Honestly, it's the most rewarding career. And yes, it's a career. It's not a job. It's a career, and it's a professional career. And how exciting is it to wake up energetic and be excited to go to work and have all the flexibility that you need in creating your schedule? Because remember, you're only accountable, one, to yourself and to your clients. You'll wake up and you'll feel empowered. You'll feel valued because you know that you are here today being a health advocate from all of your education, experience, expertise. that you will feel so empowered that you get to use that in a way that you truly make a difference. And people are going to appreciate you, your clients, your families, other professionals, providers. They're going to see this and they're going to be like, wow, you do some amazing work. You really help somebody. That is so rewarding, to go to bed every night and know you truly help somebody. What does it really take to start a health advocacy business? What does it really take to start a health advocacy business? Passion. That's what you need. That's all you need, is the passion. And that will drive you. That will get you up every morning, get you to work hard, is the passion. I met with an advisor a few years back when I was looking to expand my business. And I thought I needed someone else or needed something more. Really wasn't sure like what I needed to get to that next level. And what he said to me was, you've got everything it takes. You already have it all. But surround yourself with people who are going to elevate you in your profession. So I'm going to pass along that advice. As you're on this journey, and it is a journey, of starting a health advocacy business, surround yourself with only people who are going to lift you higher. They're going to support you. That is what we all need. We need people around us who are going to support us. You're making probably one of the best decisions ever to become a health advocate.